And we are back on the WHHI-TV Daily News. We are going to be talking about some breakthrough treatment for brain cancer right now. And here to do that with us is Dr. Katy Peters. She is the professor of neurology and neurosurgery at Duke University and a patient that's dealing with this issue right now is somebody named Rachel. So thank you both for being here today.
Thanks.
Thank you, Betsy.
Yeah, so Dr. Peters, let's start with you. Let's talk a little bit about what glioma is and specifically IDH-mutant glioma and what we need to know about it.
So glioma is essentially a primary brain tumor. That means it starts in the brain. It didn't come from somewhere else in the body and then go to the brain. We know that for every kind of tumor, it needs to have something that sort of makes it grow, that turns it on. And we know for primary gliomas that one of these mutations that can do this is called isocitrate dehydrogenase, also known as IDH. And that's really the genetic underpinning for these tumors. It tends to occur in patients around the ages of 30s to 40s in sort of their middle of their lives and can cause a lot of serious consequences.
Okay. And so, Rachel, this is something that you've been dealing with, as I understand it. So tell us a little bit about your diagnosis and what the symptoms were that you were having before you were diagnosed.
Sure, I was at work and all of a sudden I started having these experiences of deja vu, and they got worse and worse and worse, to the point where when I went to the hospital, I wasn't sure what my name was, I wasn't sure what my birth date was or what meds I was on. So after a series of MRIs and working with a neurologist, they determined that I had a tumor in my frontal lobe.
Wow, that's quite something. And those are pretty drastic symptoms. And so tell us a little bit about your treatment journey so far, and I know Dr. Peters is going to kind of address that as well.
Sure. So after I had surgery and they took it out, they did the biopsy and determined it was IDH-mutant. I was on watch and wait for about a year. I had quarterly MRIs. At that point, my tumor started to grow, so they asked if I could go on the Indigo study, which has been sponsored by Servier, which I am a paid spokesperson for. And I was on it for about 2 years. It was triple blind, so I didn't know if I was on it or on the placebo. Okay. Neither did my doctor. So after about 2.5 years, the tumor started to make noise again, and they determined after unblinding me, I was actually on the placebo. So they put me on the actual drug, and 2.5 years later, my tumor is stable, and I'm able to just go and live my life as normal.
Good for you. That is an outcome we all want to hear. So that's great. So Dr. Peters, I know there's some different things that are on the horizon for this, and obviously Rachel just mentioned a little bit about it. So tell us about what's going on with FDA approval and things going forward.
Yes, so that the FDA did approve this agent, also known as Voranigo, in August of 2024. And the reason is because this pivotal phase 3 study, it randomized patients to receive either Voranigo or placebo. They had to have evidence of tumor on MRI imaging, and they had to have a grade 2 tumor and have the IDH mutation. And what they found in this clinical trial is that the patients that received Voranigo, they had a much longer time to their tumor changing and growing. So we call that progression-free survival. Not only that, the patients that were on Voranigo could delay significantly the time to next intervention. That's the time to needing more surgery, the time to having to go to maybe radiation therapy or even cytotoxic chemotherapy. So based on those very positive results, Voranigo is FDA approved.
Okay, and so we've got about a minute left, and I just want to touch on the role of molecular and genetic testing in terms of treating glioma and, I guess, detecting it as well.
Yes, so traditionally what we do when somebody has a tumor is we just look at the tumor tissue underneath the microscope and it tells us what it is. But now we can be much more sophisticated and do an entire genetic testing of the tumor. And then actually it allows us to detect that IDH mutation and then provide those targeted therapeutics.
Excellent. Well, thank you for sharing about this with us today. Obviously, we always like to hear that things are going forward and that there's hope for people that are diagnosed with this. And Rachel, congratulations on the success of your treatment so far. We hope that continues for you.
Thank you very much.
And we'll be back in a moment, so stay tuned.